Effects of cannabidiol on drop seizures in the Lennox-Gastaut syndrome. Cannabidiol has a uses for treatment-resistant seizures in patients with several early-onset epilepsies. The Lennox-Gastaut syndrome is a severe development epileptic encephalopathy that have multiple causes, characterized by several seizure types, several cognitive impairment, and an abnormal electroencephalographic pattern of slow spike and wave complexes. Drop seizures due to an increase in the tonic or loss of a tonic motor tone are characteristic of these disorders and often result in serious injury.
Lennox-Gastaut syndrome. So, Lennox-Gastaut syndrome, or LGS, is a childhood onset epilepsy. Occurs in the second and sixth year of life. The classic EAG will show slow spike wave activity. The seizure type is tonic-clonic or grand mal seizure. There is slow psychomotor development. Death is often related to accidents. There is no treatment for it. You can try anticonvulsant because it's seizure. You can try steroid, anesthetic, or phenamide. So to remember Lennox-Gastaut syndrome, I drew Dr. John Lennox. If you don't know him, Google. He's very famous. He has 3 doctorate degrees, 3 PhDs. So, brilliant since childhood, that's childhood epilepsy. He always talks about suffering because of epilepsy. He speaks slowly, that's slow psychomotor development. He's so strong in logic and philosophy, no way you can defeat him. So there is no treatment for Lennox-Gastaut syndrome.
Applications in medicine. Cannabidiol reduces the frequency of seizures in animals with epilepsy, and probably in humans too. A controlled trial showed that cannabidiol reduces the frequency of seizures among children and young adults with Dravet syndrome. Epilepsy is a spectrum of disorder that have different types. The atonic seizures, drop attacks, is when a child or an adult suddenly falls. After 10 seconds to a minute, they recover, regain consciousness, and can stand and walk again. Epidiolex is a prescription medicine that is used to treat seizure associated with Lennox-Gastaut syndrome or Dravet syndrome in patients 2 years of age and older.
Food and Drug Administration has approved the first prescription drug made from marijuana, this one for 2 rare forms of epilepsy.
But as CBS 2's Dr. Max Gomez tells us, this could spur much more research into other uses for medical marijuana. Doctor.
That's right, guys. So now we have an interesting situation where a federal agency is approving a medication derived from a drug that's still illegal under federal law. Cannabis was used to treat epilepsy as far back as 1800 BC, and Victorian-era neurologists used Indian hemp on epilepsy with great success. Here's the 2018 version. The new medication is called Epidiolex, a strawberry-flavored syrup containing a purified marijuana extract known as cannabidiol, or CBD for short. CBD is one of many compounds derived from cannabis. Another is THC, the main psychoactive compound in marijuana. But unlike THC, pure CBD products won't produce a euphoric effect. Dr. Oren Davinsky, internationally known epilepsy neurologist, has studied and published numerous articles on using CBD to treat the 2 rare forms of epilepsy that Epidiolex was approved for.
This is really a landmark for people with epilepsy in the United States. It's also a landmark for American medicine. It's the first time a cannabis-based product from the plant has been approved by the Food and Drug Administration. I think for these children and young adults with very severe epilepsy, this can significantly, positively impact their life.
Even though there are numerous approved epilepsy drugs, Dr. Davinsky says there's a pressing need for something like Epidiolex because it has a completely different and better tolerated mechanism of action.
Pros and cons. Epidiolex may cause liver problem, itching, and fever. Is not safe and effective in children under 2 years old and may cause suicidal thoughts or actions. Pros. Is approved in a 2 years old children and reduces epilepsy in a 75%.
In this study, we treated children with Dravet syndrome, which is a very serious genetic form of epilepsy that unfortunately has a very high seizure burden and a very high mortality from epilepsy, that these children who had not responded to often 5 or 10 other treatments were given cannabidiol or a placebo in addition to their existing medications. Cannabidiol is the major non-psychoactive ingredient in cannabis, also known as marijuana. So cannabidiol does not produce any high or psychoactive properties and therefore has less potential side effects, especially for use in children, than a psychoactive compound such as THC.
We were in the double-blind, placebo-controlled phase of the study, and we did that for 14 weeks, and we were like totally convinced that she was in placebo because her seizures didn't change at all. And then we were able to roll into the open-label extension. And the second day that we were in open label and we knew that she was getting the actual drug, she went seizure-free, like completely seizure-free for 2 months, which has never happened.
The main findings of the study were that there was a very statistically significant reduction in the convulsive seizure frequency in patients who were randomized to cannabidiol when compared to patients who were randomized to placebo. So the message is that cannabidiol does work in reducing convulsive seizures in children with Dravet syndrome.
In Ecuador, LGS has approximately an incidence of 2 cases per 100,000 population. 5% of patients who are treated with cannabidiol became seizure-free, compared with none of the patients in the placebo group. The median percentage reduction of baseline in drop seizure frequency during the treatment was 41.9%.
News for families of children with epilepsy. A British pharmaceutical company says a study shows a cannabis-based drug may dramatically reduce seizures in patients with a specific type of epilepsy. For several years now, cannabis oil has been used to treat children with epilepsy in the United States state of Colorado, where marijuana is legal. CCTV's Hendrik Sabrandi reports.
We're glad to be there.
It's been a rough last few months for Ernie and Nicole Senna and their daughter Amelia. She began suffering seizures right after she was born last December.
She was unresponsive. She was limp. Her eyes were rolling back into her head.
It was really intense. It was scary.
Doctors told them Amelia had epilepsy. The seizures continued. Then one day her heart stopped beating.
They had to resuscitate her. That was probably the hardest thing I've ever seen. And then about an hour later, they did it again, the second time.
Amelia was flown from New Mexico, where the family lives, to Children's Hospital in Colorado. But seizure medications didn't work there either. Desperate for a solution, the family turned to a product called cannabis oil.
It was a family member that made a comment saying, "You should look into this. It's helped a friend of mine."
2 months after birth, Amelia received her first dose.
It was a shock. It was like night and day.
We were getting to have a baby again.
The hemp oil the Sennas now rely on is non-psychoactive, but has high levels of a cannabis compound that's found in the marijuana plant. The oil appears to have helped some of the 30% of epileptic children who don't respond to traditional drugs. Amelia is part of a children's hospital study of a product that's not approved under federal law.
So we are not allowed to prescribe or recommend dosing. In fact, we don't have any data to tell us what dosing to use. So we are simply observing families who are providing this product to their children.
In conclusion, cannabidiol reduces the incidence of drop seizures more than placebo, especially in the Lennox-Gastaut syndrome.
8-year-old Lavi Parush, moments of joy are all too brief. Diagnosed with severe epilepsy and cerebral palsy from birth, leaving him with brain damage, he suffered seizures, dozens a day. Now they're nearly all gone, with just a few drops a day of medical marijuana, cannabis oil, mixed into his food.
We saw a difference immediately, and then after a few weeks we didn't see any seizures at all.
Other medicines didn't work, his father says, or worse, caused severe side effects. Lavi has now been on medical cannabis for a year and a half. This cannabis oil was developed in northern Israel. The oil is high in CBD, the pharmacological ingredient in cannabis, and low in THC, the psychoactive ingredient, the drug that makes you high. There's little research on the effects of medical cannabis on babies, but Parush has all the results he needs. Lavi hasn't had a seizure in months.
It's just kind of when we feel that.
He takes the CBD oil daily and a second oil of THC only when Lavi is having a bad day.
When you give Lavi a drop of THC, that's the psychoactive ingredient in cannabis. It makes him high.
In the beginning we were pretty anxious about it, I guess. But then we thought, well, what are we seeing? You know what I mean? We're seeing this kid that was before he was in distress, and now he isn't.
At home, Parush and his wife play with Lavi and his little sister Geffen. The difference in development is stunning. She is 10 months old, a third Lavi's age, and yet she can hold toys and play with her parents and so much more. This, Asaf Parush fears, will always be too much for Lavi. Instead, he just hopes one day to hear his son say dad.